Good afternoon, everyone. Thank you for joining us this afternoon. We haven't held a press conference in a little while, so we thought it might be a good idea and a good chance just to get caught up with all of you and touch on a couple of specific areas that we wanted to report out on to you today. And we can certainly take questions as we go along and or at the end. So the first area that we wanted to talk with you today is on to give you an update on the Corning Center's nursing home. As you know, that's been in the news a lot lately, so we just kind of wanted to run through the numbers a little bit with you. The first positive resident at Corning Center was tested on September 3rd, and we reported on, once we found out the results, it was over the holiday weekend, and then we reported that out to you all on September 8th. Over the next couple of weeks, of course, more and more residents and staff ended up testing positive over the course. A week later, we had 3 more residents, and then just a few days after that, we had 4 more residents. And so at about that same time, Corning Center did do universal testing and swabbing of all of their staff and residents, and that was completed on September 21st. Simultaneously to that, I had requested that New York State Department of Health come down and perform a infection control assessment on that nursing home that just simply checks their infection control protocols to see if there's any problems that they would notice in those areas. They did do that. They completed that on September 22nd. So far to date, we have reported out to you that 36 residents at Corning Centers have been positive. However, I will tell you that today we plan to report out that there are 15 more that are positive, 15 more residents. And also today we've reported out 23 staff members, but we do have a couple more, so there will be to date 25 employees who are positive. So the work there continues, and we work closely with New York State Department of Health on this, as well as Corning Centers, to try to contain the further spread and transmission of COVID within that nursing home. So then to move on to talk to you a little bit about cases in general. I'm sure you know very well that we've been experiencing a pretty significant surge in the amount of cases. In August, we only had 20 cases. But now here we are at the end of September, and we've already had 121 cases that have been investigated. And even with just another day to go in the month, there's going to be a good number more that are investigated and reported out to you. In addition to that, hospitalizations are also a little bit on the rise. Currently, we have 10 hospitalizations related to COVID. The other thing that's a little different this time around than back in the spring when we were experiencing a similar spike in surging cases. Now we're seeing more younger individuals, more minors who are being diagnosed with COVID. We recognize that probably a big part of that is in the spring. We don't believe that many children, minors were getting tested. The focus then really was primarily on the elderly, and certainly older age range. But now, because with school having reopened and children exhibiting some symptoms that could be related to COVID, there's definitely more testing going on for them. So therefore, we're seeing some more positive cases related to the younger age group. Right now, our age group is anywhere from 11 to 85 years old. So that kind of gives you it's quite a broad span of age that COVID is impacting in our county at this point in time. And then just generally speaking, COVID protocols related to good public health. One of our main focus areas, certainly in public health, is prevention. But our case increase is alarming, It's concerning. And so because of that, we just really want to reiterate and remind the general public. I know you've what those COVID protocols are and what prevention strategies are associated with that. I think it's included almost daily in our press releases, but at this point, because we are experiencing such a surge and such an increase, we really are strongly asking for the community's cooperation and help and assistance in continuing to follow the guidelines that have been put in place for the COVID protocols to prevent further transmission, really ever since March. And just by way of reminder, the non-essential gatherings, we are still at a limit of 50 people or less. That has been in place since I believe the end of June. You may recall we started at about 10 could gather, and then 25, and then it was increased to 50, and we've been at 50 ever since. So any non-essential gathering, wedding, parties, things along those lines, there cannot be more than 50 people gathered together for that. And we have had cases come out of large gatherings. So it's not a small point. It's a very important point and message to remember that this is no time to start gathering 100, 200, 300 people together. By way of reminder, churches and worship services and synagogues, they are allowed, those buildings, those services are allowed 33% of their maximum occupancy. Household groups that attend church together can certainly sit together, but then household groups should be separated by 6 feet once inside the building. If individuals are singing, then you need to have 12 feet of separation if singing, or if there's a worship team where wind instruments are being used, those in the worship team should be separated by 12 feet. Another reminder we wanted to give to you is the travel advisory list is still very much in effect. That is goes for both domestic as well as international. Domestic, I'm sure you're well aware that there is a travel advisory list that the governor has created, and he adds and deletes states from it every Tuesday. Those who travel to a state with a high infection rate that is on the list, they must quarantine for 14 days upon return. And similarly, international travel is still an issue, and still individuals who travel to a level 2 or 3 risk country that the CDC has established on their website, and it's most countries actually are at a level 2 or 3 as identified by the CDC. Those international travelers who return from those countries must also quarantine for 14 days. We need the help of everyone to abide by these, to help slow the spread. If those individuals who have tested and will test positive, we need them to be very clear and helpful in identifying who they have been with and where they have been. If we can get a really good, complete, accurate reporting from that individual, then that aids our contact tracing immensely, and we can immediately get in touch with those individuals and list the businesses and organizations that they have been to in an effort to get those potential exposures in quarantine as well. We need to really continue to move forward and demonstrate aggressive containment. That's the best way at this point in time that we can, that's the biggest impact that we can have on the spread of COVID at this point in time. So we would just ask the public to continue to work with us in this area. We recognize there's many people who test positive that don't have any symptoms at all. And that's one of the things that makes COVID-19 very difficult to get our arms around it. And when that happens, individuals are unknowingly, certainly unintentionally, spreading the virus. So continuing with the COVID protocols of masking and social distancing and no large groups, that's the best way for those asymptomatic, those people who do not have any symptoms at all, but are unknowingly positive. That's the best way to prevent that spread. So if at any time anyone begins to not feel well, they should certainly take the initiative to go ahead and get tested. So that's in a nutshell what we wanted to provide for you today. I think Jack certainly has maybe some other words to add to it, and then I think we can probably take some questions.
Yeah, thank you, Darlene. That was great. Very, very helpful information and very needed. Public health obviously advocates and puts out messaging every single day, multiple times a day. And Laura Lee Wagner and Darlene do a phenomenal job with that. But the message is clear, and we wanted to raise the alarm again because it obviously is getting to that point. Like Darlene said, we were at a very manageable number. Obviously, we want the number of daily cases to be 0, but over the summer, we were seeing many days of zeros. That's not the case any longer. We're reporting well over 100 this month, as Darlene mentioned, and the month is not yet over. If you look at the metrics across New York State, ourselves, Chemung County and Broome County here in the southern tier are driving what is the highest 7-day rolling average per 100,000 in the state of New York amongst the regions. The governor also mentioned clusters in the Hudson Valley and on Long Island as well. These are not lists that we want to be on. We do not want our cases to be growing at the rate that they are. And again, I growing up in this community, like many and most of us have, we have a lot of faith in the community, and we don't think that anyone is acting with ill intent. But what we're seeing is just a series of poor choices that can lead to a tremendous spread and a tremendous just strain on our system. What we're looking at is serious public health consequences, but the other thing, and that's our first and foremost concern, is the health consequences. We hear and we see and we get questions all the time about, well, is this due to an increase in testing? Some of it, catching the asymptomatic positives, very well could be from an increase in testing, but we are seeing many, many more symptomatic individuals who are getting tested. When Darlene and her staff worked with the Department of Health to stand up a 2-day drive-through site, we were flooded. We met the demand. If we had more space allotment and more testing allotment from the state, we would have filled that up even further. So the virus is spreading within our community. We're very, very concerned. And we also urge individuals, like Darlene said, follow those common sense protocols. This is not talking about individual liberties. This is not talking about individual rights. No one here in Steuben County is even looking at infringing upon any of those things. What we're asking for is a sense of community pride, a sense of community togetherness, and for everyone to make smart decisions about things that they absolutely need to do or things that they could put off. Do I need to go to a gathering of 100 people right now? The answer should be universally no. You do not need to do that. And for the good of the community, we need to make those good choices. And the message that Darlene and I always send as well is the health consequences are number one, but we also need to think about the businesses and the business community who have endured so much during the shutdown. We want to keep them open. And the easiest way to do that is a low number of cases. The other thing is schools reopening. Speaking personally, I want my children to have an in-person education. I know almost every parent wants that right now, but the trend that we are seeing is threatening that. We absolutely need to get this outbreak here locally under control so that we can keep our students in school and keep our businesses open, along with keeping our community healthy. So thank you all for joining. And as Darlene said, we can take questions now.
And just before we take questions, I do need to make one point of clarification. The age range that I gave you of 11 to 85, that's for those who are in the hospital. The age range for our positive cases are 1 to 94. So that is significantly different, and I wanted just to offer that clarification. Any questions at all?
Can you repeat the number of active cases?
Our age range for our positive cases is from age 1, actually a little bit less than 1 to 94.
Is there an exact number of how many cases are in the county right now?
Do you mean active cases?
Yes, ma'am.
Yes, we have that. While other questions are being asked, I can look for that.
Thank you.
Unless, so.
Yeah, we have 101 active cases that we have reported as of yesterday, but the press release that we have has not been sent. The daily update has not been sent yet. It will be sent by the end of the day. We will be reporting many more cases.
So let's go, I'll go down name by name and then unmute you so that we have kind of a better system for asking questions. Christina, I think those questions were from you. Do you have any further questions before we move on?
Nope, I'm good, thank you.
Ariel, do you have any questions? No, we can't hear you.
Okay, while Ariel is doing that, if I could, Jillian had a question regarding targeted testing, and Darlene, if you don't mind, I'll quickly mention that. There is more to come on that. We are actively working on expanding local testing capabilities. We're looking at, we're working with the state and other counties in the region, so yes, we are actively working on that in conjunction with the targeted stand-up testing that Darlene and Public Health worked with the New York State Department of Health on last Friday and Saturday. So much more to come on that in the coming days.
A question was asked in the chat box from Marshall Hyde, wondering about the turnaround time on those tests. They do vary. They may come in as quickly as 24 hours, but we don't have all the results yet. So hopefully a max of 5 days, but we were not given a specific time frame for the end of when all of those tests can be expected.
So I see Ariel's question, is the increase of younger cases correlated with schools being back in session? I mean, I think that, you know, that is certainly a contributing factor, but as I mentioned, I think another contributing factor is the fact that there's, because schools are back in session, more kids are being tested, where in the spring, when we were experiencing a surge in the number of cases, we weren't seeing as many minors being tested at that point in time. There was such a focus then on the older age. So I think it's both. I think it's increased testing of younger kids, as well as now they're back in school and you know, around a lot more people than they have been since March 13th.
Yeah, so to that point, we haven't seen yet where any of our positive cases related to schools have then turned into multiple positives related to that. You know, it is still early that we can't say that some of the cases even got it at school. That hasn't been the clear indicator yet. So we'll keep that in mind as we do a lot more cases coming in, but that isn't super clear yet that it's even spreading within the schools. It's just that kids who are going to school are now being tested, so it does end up impacting schools that way.
And one additional point I'd like to make about that is logistically, the cases related to schools are so challenging for the school, for public health, for everyone from a contact tracing standpoint. And that goes back to emphasizing, you know, making good choices, keeping your social circle small, doing the basic, wearing a mask in public, the basic public health concepts, because some of the cases that we have seen here recently over the past week that involve schools are just so logistically draining on the schools, on public health, on the entire system. And that's part of the job, and they do a tremendous job doing it. But it just has so many ripple effects that are unintended with these cases connected with schools. So it's concerning.
One of the questions that came in from Natalie was around the Lighthouse Baptist Church. To my knowledge, only 2 of our cases were related to Lighthouse Baptist Church. One was an attendee, one was in contact with someone from Lighthouse Baptist Church. The other thing to note is if cases or contacts, it's really the contacts to cases from other counties, when they're transferred to us, it's not always indicated where that positive was exposed. So we're not sure of all of our transferred in contacts if that had to do with a specific event necessarily. So we are aware of 2 positives in Steuben County that had some connection to the Lighthouse Church.
A follow-up.
Oh, go ahead.
Sorry, a follow-up to Ariel's question. Stricter regulations. It really would be the state that would decide what those regulations are. We do not set those locally. The governor, again, in his press conference, made that very clear that counties, cities do not set regulations for what's open and what's closed. But I would be concerned. I don't think that you'll see a shutdown or a slowdown, but with the rise in cases, it is very concerning, especially bars, restaurants, schools, those things that have opened the latest and have the most amount of interaction. Those are the things that I at least personally worry about when we see these case numbers spike, but we have not heard any indication of anything shutting down at this point.
So one of the questions, they're coming in fast, from Christina around the number of active cases at Corning Center, wondering if it's now 40. As we mentioned earlier, we have so far reported through our press releases on 36 residents and 23 staff members. So that would be 59. But again, we are going to report about 15 more residents today, as well as more positive staff members. So we will be above 60 active cases at Corning Center by the end of the day. And then to clarify Natalie's question, positive cases are counted within the county of their residents. So when I said that we have 2 cases that have a link back to the Lighthouse Church, they are counted as Steuben positives. They are not counted within Chemung.
I can also jump on to Jillian's question regarding Boone County receiving rapid test machines. We are in communication with the governor's office and with neighboring counties about that and about other options for testing. So that is actively being worked on, and I would expect additional information to become available in the coming days. I could also, if I could, follow up on Marshall Hyde's question about closing down Market Street. Both Darlene and I have been in contact with the Gaffer District, with the City of Corning. We have worked closely with them on their closures during the summer. I think it went fantastic. Didn't really see any issues. We did receive a few complaints here and there about individuals when they were crossing the street or in the street not wearing a face covering. Worked with the Gaffer District. Darlene and I both had calls about that. Worked with the Gaffer District in the City of Corning. So it seemed like it went well, but to answer the question directly, I think with the spike that we are seeing, at least personally, I'm growing a little more concerned about larger gatherings, even if they are outdoors. But Darlene would be the one to really speak to that as the authority.
I think that's a great question, and I would certainly agree with Jack. During the summertime, I think very well, and we were experiencing our lowest numbers, and rate of the rate of transmission was the slowest since this began. So I think it was the ideal thing to do in the summertime to give people a break and give the restaurants and businesses on Market Street a shot in the arm that I'm sure that they needed after a long shutdown. I do know that I am in current communication with the Corning City Council at this point, and there is a meeting scheduled for tomorrow night around this, where discussion will take place. But in light of our recent numbers, I am now concerned about it. So, but there will definitely be more conversation and discussion, and just even within the next day.
Follow up quickly to Natalie's question about the violations and the penalties. All of those are still the same. They are still in place. When we get a pause violation, one of our sheriff's deputy goes out to see what's going on, to have a discussion with, most of the time it's a business owner, but if it's a person we get a complaint about not quarantining when visiting a hotspot state or country, we still have those conversations. In some cases, if we get a few complaints, Darlene, the sheriff, and I will go out and have a conversation with a business owner, and we have done that about half a dozen times. And we don't want to see our local businesses get fined for not enforcing face coverings, not enforcing social distancing, or having too many individuals not following state regulations. What people need to realize is these are state regulations. These are not I should do or I might do. It's you have to follow these regulations, and it's the state of New York that regulates these businesses and can fine them. And we have seen instances in our community where charges or violations have been written by both the New York State Department of Health and the State Liquor Authority against some of our businesses. And we want to prevent that at all costs. So our message and Darlene's message is education. To educate those businesses and individuals to follow the regulations so that they can avoid any penalties.
George, I see your question. You're wondering if something has changed at Corning Center, given that they really never did experience positive cases in the spring, and now suddenly they have a great number of cases. It's really kind of hard to say. The infection control assessment that New York State Department of Health completed did not have major red flags as far as a breach in protocol for the center. They did offer them, a few recommendations on things that could be improved upon, but not any major red flags related to that. So then, that really does come back to, who's coming into the nursing home, between staff and what few visitors. It's my understanding that they only had about a 2-week time period of visitors. I think they started allowing visitors the middle of August, but by Labor Day weekend, which was only 2 weeks later, they had their first positive COVID case. So it got shut down again, and still 2 visitors. So there was only a 2-week time period there for family members and loved ones to come in and visit.
So to follow up on Jillian's question, hit on an important point, which is cooperation between the neighboring counties. It's been tremendous. I really thank County Executive Moss. I know that Darlene is also working very closely with Pete Bizzetti, their Director of Public Health. Cooperation and coordination amongst our counties are so critical. We work well with all of our neighbors all the time, but we're working even closer, really on a daily basis, hourly basis, especially at this point with Chemung, because there's so much interplay between our 2 counties. We have so many residents that live in Steuben that work in Chemung or the other way, and so much travel in between. So it's very important that we work together, and I really do thank County Executive Moss for his partnership. We're in this together, and we're coming up with additional regional solutions to actively and proactively combat this.
I see both George and Natalie are asking about Halloween and trick-or-treating this year. I can tell you that I'm hearing verbally from the state that it is going to be allowed, and that there will be guidance forthcoming around what that should look like. I personally think that it can be done safely. Again, no large Halloween parties, with every neighborhood child and parent brought together to have that party. But I think, parents with their children can go about it in a safe manner. But we are waiting for the guidance to come from the Department of Health on that very soon.
And Darlene, do you want to answer Natalie's question? That'd be for you or Laura Lee about how the contact tracing has gone with restaurants.
Yeah, I mean, it's gone well. Fortunately, we haven't had a lot of contact tracing that we've had to do with restaurants so far, but the ones that we have had, they've been cooperative. And telling us as much information as they know about potentially where, who they have been in contact with and where those potential exposures are.
The rest of that probably is for me about budget. From what I'm seeing, Natalie's question regarding budget, very challenging. We're in the midst of budget development right now. We present to our finance committee of the legislature in the middle of August. It's the most challenging budget that I've seen in the 12 years that I've been here, much more so than the Great Recession of the late 2000s. All departments are really stepping up to find efficiencies. We have done an early retirement incentive for staff and have had a number of takers for that. What we want to do is avoid layoffs at all costs, and I think we're going to be successful in doing that because of the number of early retirements that we are having. But the federal stimulus is absolutely so important, and it's important for us because of our loss in sales tax, but it's even much more important to the state, in my opinion, because we rely upon state aid so heavily that a 20% cut, which is what the governor is saying, right now they're withholding most of our payments, and the payments that we are getting are being reduced by 20%. That 20% cut, if it is made permanent, equates to about $5 million for Steuben County, which is 10% of our tax levy. So it's very, very important that a federal stimulus happens. We're hearing encouraging things. We thank Congressman Reed for his efforts in the Problem Solvers Caucus to kind of break that log jam and get them back to the table. So I'm at least personally encouraged by what we're hearing out of DC these days. But yes, the budget is very, very challenging, and much more to come on that in October. No time frame on the stimulus. They are actively negotiating now. Really, obviously, the ideal thing would as soon as possible, but certainly before Election Day, because who knows what will happen and what the climate will be like in DC at that point. But we're hoping that something happens very soon. To George's question, I know our election commissioners are working very closely with Darlene and her staff for precautions at polling places. Tim Marshall is on the phone and has distributed PPE and sanitizer and all of the protection items to the elections department. But it is a very challenging time for poll workers. Getting poll workers in a normal year is challenging. But it's even more, much more challenging this year just because of all the protocols that are going to be in place. So actually, our Board of Elections is doing training all of this week. It does look like we have a sufficient number of poll workers for the coming election, but it has been a challenging venture.
Are there any more questions? Okay, Darlene and Jack, would you like to wrap it up?
Sure. Again, we just do want to thank you for spending this time with us and helping us to get the word out again. I know probably to some we sound like a broken record, but we just felt like we hadn't been with you or the residents in this manner in quite some time. And because of our growing concern over the alarming rate at which our numbers are increasing, we really wanted to just reach out and ask for everyone's help and assistance and partnership and being diligent in following the COVID protocols. It's the only way that we're going to stop the spread. So we appreciate very much you working with us to get this message out now.
Okay, thank you everyone for being here.
Thank you again.